and 1.
All right, so Senate Government Operations, it is Friday, April 16th. We are rapidly getting close to adjournment here, so we're trying to fit things in. And so I apologize to anybody who thought we were going to do something today and we're going to do something differently, because we're having to really juggle schedules right now to make sure that we get things done that have to get done, and then things that don't have to get done by next week, we will continue to look at, but there are some things that have to get done this week. So there are 2 things I would like us to be able to do right now so that we can finish up with them. One is the Pay Act. I forwarded to you a message from Pat Gable saying they supported it, and from the Department of Sheriffs, from Annie Noonan, Department of Sheriffs and State's Attorneys, saying they supported it. So I would love for us to be able to tell appropriations that we are in support of the Pay Act the way it is, so that they can get that off their schedule. So Senator Clarkson, you're muted.
I'm trying to be so good. I would move that, even though we don't have the bill, technically, I would move that we support the Pay Act as represented in what is it, 439?
No, it's the House Appropriations Bill.
I think that's H 439.
Oh, is it? Okay.
Whatever the big House bill, I believe it's H 439.
Okay.
We vote that we support it favorably, that we fully support it.
Okay. Any disagreement with that? Okay, so we can send that note to Jane then. The other thing I would like us to do this morning, this afternoon, if we can, do we need to have more conversation about the 3 nominees that we heard from yesterday?
No, I don't know.
Okay. So I would like then for us to be able to forward those to the, because they have to remain on the calendar for a certain number of days before they can be confirmed. And so I'd like us to get them to them today, if that's possible. Keisha?
This is just related. It's not a delay, but I remember we talked about who appoints the advisory board, et cetera. Has that happened? We haven't, when does the advisory?
Well, I don't know, but we don't confirm them.
No, I know we don't, but we had made it clear that we really wanted them to start their work too. And I just don't even know where that still is.
Well, I think it's the cannabis. It's different sections, different places that appoint people to the board. But I think that once the board gets functioning, they can ask for those appointments to come. But
It's a good question, actually.
I mean, I can follow up on that, but I don't want to see us delay the Cannabis Control Board.
No, I think we should move on that as rapidly as possible.
Okay, so can I I would like to confirm, report favorably and report James Pepper.
Oh, these will necessitate reports?
I don't know, but if it does, we should be ready.
Okay. Do you want to check with Bloomer to find out?
Well, I can check later, but
I'm happy to do anyone you want me to do.
I don't.
If you
We should be ready with a report in case, and I will check, but what I'm trying to do right now is get us to confirm, to send their confirmations up to the Senate.
Getting our vote. Okay.
Yeah.
Yes.
Yeah.
You're moving the confirmation of James Pepper.
Yes.
Yeah.
We ready?
Aye.
Aye.
Oh, are we
Okay,
doing? Okay. Yes. We're doing the vote. Oh,
Yeah,
okay.
we just all voted.
Okay.
We don't need a formal. Do we need a formal vote for Keisha to do that?
We did for the commissioners and the
Okay,
secretary.
let's just do it. Let's just do it. So Keisha, would you please call the roll?
Yes, Senator Clarkson,
Yes.
Senator Collmore,
Yes.
Senator Polina,
Yes.
self Senator Ram, yes, Senator White.
Yes. And if there needs to be a report, I will be prepared.
Okay.
Okay, Julie. I would say that we support her nomination and ask for confirmation by the Senate. Can we do a call?
Vote.
Roll?
Senator Clarkson,
Yes.
Senator Collmore,
Yes.
Senator Polina,
Yes.
myself, Senator Ram, yes, Senator White.
Yes. And
Fine.
I don't know, but Keisha, if there has to be a report, would you do it? I know that you've worked closely with her.
I would be honored.
Okay. And Kyle. I would support his nomination to be sent forward to the Senate for confirmation.
Yep. Okay. Senator Clarkson,
Yes.
Senator Collmore,
Yes.
Senator Polina,
Yeah. Yes.
myself, Senator Ram, yes, Senator White.
Yes. And perhaps one of the two members from the Ag Committee would like to be ready to report him if we need to.
I mean, I'll do it. It doesn't, it's
Okay.
fine with me. Unless Brian wants to do it.
Yeah, I just soon do it, actually.
Okay.
Okay. So you're going to do it.
I thought we're going to duke it out between the VLS bond, and ag.
What?
His VLS, his Vermont Law School.
Oh, no, we're doing Ag.
I got it.
Sometimes I just make a decision and I don't really care what you think, Senator Clarkson.
I wasn't suggesting you did.
Usually I do care. Okay, so thank you. I just wanted to get those two things out of the way so that we can send them on up to the appropriate people. So with that, let us go to the talking about the ARPA money, and Drew did send us an email. It is posted on our website, or not an email, but it's posted on our website about what their ask would be. So Drew, would you like to talk to us about that?
If I click the right buttons, can you hear me now and see me? All right. So yes, thank you for the opportunity to speak. After our last discussion, we did have an ambulance association meeting with really good attendance. Had the opportunity to discuss with services from across the state what the current challenges are. It's really the first kind of in-depth meeting we've had since the beginning of this pandemic. And the service leaders shared the same concern about workforce development and the need for additional personnel in kind of the EMS workforce. We looked at and discussed some of the kind of the complicating factors that we are currently facing. That would be the decrease in the total number of EMS providers, the rollout of the education programs that we did in the fall, but that didn't really fill in the gaps necessarily from the programs that we canceled in the spring and in the summer. So we're all currently starting to feel the effects of more than 8 months of lost workforce development time. So the focus certainly of the conversation and of the need is on attracting, but also retaining personnel in the EMS workforce. Some of the identified areas were access to education, which I think we kind of broke down that barrier with a grant program that we ran in the fall. Other areas that we have yet to really address are really the livable wage aspect of EMS. And I did put a note in the email that at some point we really do need to have a serious conversation about the underfunding of EMS through state and federal programs that's led to really almost an embarrassing pay rate for EMS professionals across Vermont. as we talk around the country about $15 an hour minimum wage for workers in other industries, I think it's important to understand that the people that are on the front lines of this pandemic, the people that are going into homes right now and vaccinating people, the people that have been treating COVID patients since day one, most of them are making less than the $15 an hour. So, and that's a direct reflection of the Medicaid reimbursement system that we face in Vermont. We get reimbursed less than the cost of delivery. But as far as the financial kind of the request, not knowing exactly, how this money could be used, we are asking that we continue the education grant programs that we started last year in hopes to just maintain the status quo. The numbers I put in there would just fill in the gaps that we had from last year. That's not making ground on the shortage. That's really just enough to kind of keep us where we're at. Other areas that were brought up for concern is because of years of underfunding, we do have health and safety issues at EMS services where living conditions, especially under the new kind of pandemic rules with ventilation and cramped quarters, could certainly be addressed if there was money available in some of the federal funding that came in for grants towards station upgrades. Noting that many of our EMS services are not town funded and will not have necessarily access to those town funds that are coming through directly through from the federal government.
So any questions? Senator Colmore, yeah.
Thank you, Madam Chair. So Drew, I'm just reading through your testimony. You're looking for 1.23 million in order to cover you over, correct?
Yeah, so the two pieces that we kind of added to that from where we were a year ago that we realized we forgot was the critical care education component and the need to develop our instructors. So that was the kind of the two add-on pieces that we kind of left out of the conversation last year. But you're correct that 1.2 million would be to kind of maintain current staffing levels.
Okay, and I'm 100% in favor of that and will vote absolutely. But my question is, are these going to be ARPA funds, which are one time? You mentioned that it's an annual need. So are these going to come out of the general fund, or are you asking for them to, or?
So
wait, I can see you wanted to jump in.
I'm going to clarify here. I don't think that Drew cares where the money comes from.
Okay.
And my position here is that we are creating a list of needs that we see, and we will forward those to appropriation with the breakdown. And if we all agree, and appropriations can figure out what might come from ARPA money, what might come from reallocated CRF money, or the ongoing budget. And I mean, and there are ongoing budgetary needs that we need to address for EMS anyway, like the Medicaid reimbursement and all that kind of stuff for long range. So that's, I didn't mean to speak for Drew, but I don't think he cares where it's coming from.
that's fair. But what I wanted to make the note of is that this is, unless we can address the retention challenges in EMS, then we're going to have an ongoing need for, and we're always going to have an ongoing need, but we're going to have this kind of high ongoing need for recruitment. And I do think that we've, by providing education vouchers, we're helping with the access into the EMS system. We do need to seriously look at how do we retain these people for longer term, so that we're not having 20% annual turnover in EMS in Vermont.
Well, you have my full support and my yes vote on this.
Senator Clarkson? And you are muted again.
A bit trying. The plus of it being ARPA money is we could do it over 3 years. And if it's ARPA money, obviously some of this for the EMS, municipal EMS, it could be conceivably part of a municipal spend of their ARPA money conceivably. I guess my question is, well, first of all, it was a great piece on VPR this morning. That was great on EMS going in individual homes and vaccinating. That was great. Really lovely. I guess one of my questions is, this is a workforce development. This is workforce development and retention. It's also how we get to that livable wage is a big concern to me. And our chair has already mentioned it. I think that is the biggest nut we have to crack here, is the Medicaid reimbursement, which we're not going to get to this year, but is one, I think, on our plate for next year. So I guess what I'd say is, if this is ARPA money, we could be asking for it for 3 years, which would hopefully get you to a point where this was a sustainable. You'd have the instructors trained, you'd have more people on deck, and hopefully better paid.
Well, I think that one of the things that I thought we were doing around ARPA money in particular is saying what, helping appropriations figure out what really has to be funded now. And when we come back in January, looking at the additional money, and then we would look again at the needs of EMS.
Right. And this is an immediate request. This is
Yeah, this is right now.
Yeah.
So Senator Pline, I saw you had your hand up.
Yeah, excuse me. I think I know the answer to this question, but I'm going to ask it anyway. When you talk about the grants, Drew, like paramedic training grants and EMT training and whatnot, $1,000 each, $1,500 each, that's only a fraction of the actual cost, correct?
So for the EMT program and the advanced EMT program, that grant was covering 75%, 80% of what the tuition per student was. The students were having to pick up fees and books and some other lab related costs. On the paramedic kind of grant, I was a bit surprised to find out that even after the $18,000 grant, many of the staff members that we had here that put in for it were still left with $15,000, $16,000 worth of student loans, which was actually more than it would have cost if they had gone out of state in the first place. So there is an affordability aspect of our current, local kind of Vermont grown paramedic program as well.
Yep.
Senator Rahm?
I think just to follow up on Senator Clarkson's question, do you foresee putting in a proposal for future budget requests in the next couple of years that do anything new for attracting people to this role, this critical role?
So this is a topic that we've been struggling with for a long time. We spent the last 3 years trying to really dig into what is causing our workforce challenges. And in EMS, every town, every community has a very different EMS structure. Everything from local kind of volunteer fast squads to regional fast squads, fire-based EMS combination, towns that have standalone municipal departments. So, and what we're finding is that those challenges are unique to each of those groups, but they do have kind of common threads running through them. And we've been trying to address some of those. And certainly this committee has helped us in the last couple of years with things like access to education and testing being a challenge for people because of the way that EMS providers are tested. It's an online psychomotor exam. With some help from you folks, we were able to expand the number of sites so that people don't have to drive as far or wait as long. Access to practical testing sites, which quite often involve, like I have students next weekend that will have to travel to Castleton for their tests. And if they are unsuccessful at passing their test, then they have to wait a month and the next test could be in Burlington. So there's still access to testing issues, but we've also been looking at other challenges as far as the kind of the maintenance of our workforce. And what we're getting kind of down to the nitty gritty on the career type staff is we're asking our EMS providers to work 70 and 80-hour weeks to make a living. Providers that, work full-time in one agency, work part-time in another, because the wages are so low. And what that's causing is a lot of people either leaving Vermont. So I live down in kind of southern Vermont, the Brattleboro area. We've lost 4 paramedics to New Hampshire and Massachusetts because in those states, they have higher wages and retirement for EMS. In Vermont, we're offering paramedics, which operate at a very similar level to an RN, between $16 and $20 an hour, which is pretty sad for the level of skill and responsibility that they have. So we're really starting to find that we're driving these people out of EMS and into other areas of healthcare. The other thing that has had an effect on us, and not just us in the southern part, but us across the state, is the nursing shortage turned into an EMS shortage. And what you'll find in your local emergency departments is that many of them now are staffed with EMS providers as ED techs. So your paramedics, your advanced EMTs are being scooped up by emergency departments and urgent care clinics that are able to pay at a rate that's 1.5 times or even double what actual EMS providers can, because of the way they're reimbursed versus the way that we're reimbursed. And I certainly can't blame those providers for trying to better their lives and their families' lives by moving to a wage that's certainly more livable than what we can offer. In many cases, we're still providing services and getting reimbursed less than what the disposable medical supplies and medications cost. So the answer is, are you planning to put a proposal together? We would love to put a proposal together as to what it would cost to fix it. If we have an audience that wants to hear it, I will share all day.
You do.
Mhm.
So, and I think that that's something we have to, there's the DIVA reimbursement rate. There's also what paramedics in the ambulance and outside the ambulance can bill for as medical services. And there's a whole series of questions that we really need to look at more in depth. And I think that, and you had a great team put together last year or 2 years ago when we were looking at this with Pat Malone and you and Jim Finger, and it just was really helpful. And I think that some things got solved and some things didn't.
Yeah, we got slowed down a little bit by the pandemic. Needless to say, like everybody else, we kind of focused on the acute emergency and did kind of sideline some of that, future planning. But as we're coming out of it, our meeting yesterday was our first step to kind of getting back on track. And I look forward to being able to provide you guys with a solution.
Good, thank you. Senator Clarkson?
So I'm just curious, Drew, if because some of your members are municipal employees or associated with a municipality, and I'm just noticing that there are a number of municipal departments that are unionizing. Has unionizing ever been an issue in terms of how you would increase pay?
So I can speak specifically for my organization, and we are a unionized shop, but the having a union doesn't affect the amount of income that we have. So unlike a municipality that has taxing authority, we're a regional nonprofit. So our books have to balance. So whatever we take in from Medicaid and Medicare is all we can spend, regardless of our desires to pay more. We simply can't. Much like a household checkbook at the end of the year, when we run out of money, we can't pay our staff. And those numbers are directly related to reimbursement. As we found out early in the pandemic, and we all knew how fragile EMS was in Vermont, but we live based on the number of people that we transport from one place to another. EMS doesn't get paid for providing healthcare, it gets paid for moving people. And
Right.
early in the pandemic, with the public health interest, we were directed to not transport people to hospitals, but to provide them care in their homes, advise them if they did not really need to go to an emergency room, not to, because that was the best thing for a public health emergency. All of those calls, all of that response, and this changed philosophy in the way that we deliver EMS has all had a negative cash flow effect on EMS.
Right,
So,
as
you know,
we've heard.
my organization in the last, and we look at kind of the first part of the pandemic, the heavy hit in the pandemic, March, April, May. But if we look at since July of 2020 until now, we're down over $400,000 in annual receivables through Medicaid and Medicare reimbursements. What that means for us is a direct reduction in our ability to hire and pay staff. So we're going to go another year where, once again, we won't be able to raise wages because we're just barely getting by with what we had last year.
So committee, I just need to tell you this. I just had a little message here that my internet connection was unstable. I have no idea what's going on, but if I lose it again, I am going to take my iPad and go someplace else, because I think that I really need to be here for this afternoon. But if I get frozen out, would you just keep here? And we have the two other, we have an estimate from the sheriff and from Jack Anderson. And I don't know if the sheriff's message got sent to everybody or just to me.
I don't know. I haven't had time to look in email.
I
Yeah.
did post that, but I posted it on April 15th. So it's yesterday's date.
Okay, that's from Mark Anderson.
No, he cannot supply anything.
Well, I just got an email from him.
You did?
Yeah.
He sent an email to tell us that he doesn't have numbers. And I told him that he could participate in the conversation to
I'm
frame
gonna
his needs.
I'm gonna forward this to everybody just in case I get lost, okay?
And Gail, I don't see anything from the sheriff's on yesterday's documents.
No,
I'm sorry, it was something from Annie Noonan.
Oh, okay.
yeah, no, Annie Noonan, I don't think she's weighed in on this, has she?
No.
And on ARPA money or for the sheriff's, yeah, it.
Oh, the Pay Act she did.
It's
Alex.
That was
Yeah.
Pay Act.
Just, sorry, Pay Act.
Like, yeah, don't confuse them here. We're done with the Pay Act.
Got it. Sorry,
Okay.
absolutely right. I just,
Okay. Okay, so I'm forwarding this to everybody just in case I get booted out, okay?
Madam Chair, can I ask a question?
Yeah. Sorry, thank you.
While you're multitasking. Can someone refresh my memory if this has an interplay with like a Green Mountain Care Board conversation about changing reimbursements? It doesn't quite feel like just a government operations conversation about how they get more money.
Well, it isn't. We asked the Green Mountain Care Board when they did their health HRAP, it's called, their health resource allocation plan, to take into account EMS. But the problem is that as Drew pointed out, EMS has always been considered a transport. It's never been considered a health. We're trying to change that conversation by
Right.
doing things like asking Green Mountain Care Board to include it in their HRAP and talking to DEVA about how we can pay them, whether they transport somebody or not, how they can pay them for medical services, and start hopefully changing the conversation about what they are and what they aren't.
So would it be
So-
fair to say it's under consideration in the Green Mountain Care Board right now?
They don't set rates.
I thought
for
they
EMS.
determine who's so they don't touch EMS. They don't determine that they're eligible for medical reimbursements.
I don't know who would make that decision. I think that The Department of Health has been working very closely with us around this to try to change it. But all we asked the Green Mountain Care Board was to consider EMS resources when they did their HRAP. That's
We
the
really
Health
wanted to-
Resource Allocation Plan.
If we really wanted to pursue this, I think talking to Jen Carby might be a good idea, alleged counsel. Because she would understand the interplay between these things, I think.
Yeah, we can. And the Department of Health has been very open about trying to change this conversation. But that isn't something that we're gonna do now. That's for the larger conversation.
That is a big discussion.
It is a huge conversation about how we change that, how we just change the culture of what it means to be an EMS provider and, or the system. And we've started the conversations, but as Drew pointed out, the pandemic really put a kibosh on a lot of those conversations. Corey Gustafson was with us at one point to talk about DIVA and how they reimburse. And so we have started the conversations. So any other questions for Drew about, can we support his request of $1.23 million?
We can.
And we will?
Yes, we can.
Yes.
Okay. We will forward that. I'll write up all the requests in an email and forward it to the Appropriations Committee. I'll use your breakdown here and forward that to the Appropriations Committee.
Great, thank you.
Thank you, Drew. And thanks for your good work.
We try
Yeah,
hard.
really.
So I had a Jim finger for me.
I will.
Yeah.
Take care. Thank you.
So
So
I
I
just
did-
got your email, Madam Chair. I didn't realize that we have two Andersons until just
Yeah.
now.
We have Mark Anderson who's the sheriff and Jack Anderson
Yeah.
who's the probate judge.
And Tucker,
I mean,
Anderson,
not probate, I mean side judge.
and Tucker Anderson, our alleged counsel.
Right.
Yeah, but I meant in the context of this.
In this context, we have two, yeah. So Jack Anderson sent the county courthouse breakdown to us and it amounted to 1.62 million.
Right.
Oh, and speaking of county courthouses, I have a letter. I will type it up. I hand wrote it, but I will type it up and send it to you for your approval to send to our delegation, asking them to please go to bat for our counties. And I'll send it to you so you can look at it and make sure that I'm saying what you think I should be saying.
Well, and
Yes,
I mean, I just, Jack Anderson helped put the county budgets in perspective for me today by sending, I asked him what the Windsor County budget was for this year, and it's over $550,000, which, you know, that's just one county. And he says that the range is all over the map in terms of the budgets. That obviously Chittenden County is well over $1 million, but these are not insubstantial budgets. I mean, so the counties exist in substantive form and are spending money and have budgets and tax rates. So it's really, we can't ignore that. Reinforces our request that the counties be considered for some allocation.
yeah, well, I will type that up and send it to you so that you can see what I said to our federal delegation, and hopefully I said it kind of right.
Yeah, I bet you did brilliantly. So the request for the budget for the courthouses or for all the counties is 1.8. I can't.
It's 1.62.
That's right. Right.
Yes. So can we support that?
Yes.
Yeah.
Sure.
Okay, all right. And then the sheriff sent, there are 3 sheriff's buildings, Chittenden, Orange, and Wyndham, that are up. Oh, I'm sorry, Senator Colomar.
No, I'm right with you, Madam Chair. I'm reading along, and I was gonna suggest that the sheriffs have asked for basically 600 to do the air handling systems for 3 of the sheriff's departments, and also 810,000 to buy the place in Brattleboro for transitional housing, which adds up to 1.4.
Yep. And it isn't really transitional housing. It's for people who are being transported by the sheriff's departments, but that can't be transported. So it's really short-term kind of crisis housing for DMH patients and DCF patients that are not DCF aren't patients, but clients. So those are the people that need some place to be housed in police stations or sheriff's offices or emergency rooms in hospitals. And that's what this would be for.
The only thing I'll say is at 810 grand, that must be a big, big building.
I think that I think there's a lot more that is being considered going into that. But I mean, $110,000, a friend of mine just sold her house here, which has 3 bedrooms for $650,000.
Really?
So
Nice
I
house.
guess-
Yeah,
So my concern here, this is just the grand list value. We don't know what it would actually cost to buy and renovate for the purpose that they're talking about.
right. And this might be something that comes out, since it isn't an actual immediate need right now. I mean, they would like to be able to jump on it, but maybe this is something that comes out of the housing money.
It may be. Yes, it could conceivably fit into I'm not quite sure which of our tranches of that would fit into, but it could. It just, to me, this is not a full budget, a full proposal. I mean, this is.
No. He jumped on it right away. Senator Polina?
But I just wondered whether institutions would want to take a look at buying this thing.
Oh,
Whether they would want to look it over.
you mean over Mark's proposal?
Yeah, in terms of buying the building or whatnot. It just seems like it might be an institutions thing. I don't care. I'm not taking a position. I'm just wondering.
Right. It's a capital investment.
Right.
Yeah.
So
Well, we
maybe
could have them look at it. I think he's thinking of having the county do it, but
Maybe we
instead
could
of the
just stick
state.
with the air handling part then?
Yeah,
Okay.
yeah, we can do that for now. Just the 600?
Yeah.
Okay,
Or we could do the whole thing and just refer to, tell appropriations that we believe it might be of interest to institutions. I hate to see it just get totally lost.
I don't think it's actually fully fleshed out enough to be ready to be proposed. That's 800. I think that the
Okay.
600, they're a clear need and immediate, but I think that this other one needs a little bit more. I mean, it needs a fuller proposal.
No, I think
Okay.
you're right.
okay. So we'll stick with the 600 for now on that one.
Yep.
And then, so I'm going to forward these, and then next everybody is here early. What time did we schedule this for 1:30?
145 right now.
1:45. Look
And
at
they're
these
incredibly timely.
prompt people. So, okay, so I'm going to forward these 3 suggestions to appropriations now, so that and then if we have more, I know we had the conversation about the community justice centers, about maybe
Yes.
giving them some funding to engage in the community conversations.
Yep.
So we can get more information on those, and then we can forward them as we get them. Okay?
Right.
Okay,
Our deadline is Wednesday to approbe at the moment.
yeah, and I'll contact the community justice centers and try and see if they're even interested in something like that. So, thank you. We're going to shift now. So I'm going to tell everybody who's here. I'm going to just make a couple statements, and then just in case, I keep getting a message that my internet is unstable. And yesterday it completely kicked me off. So if that happens, Anthony will take over and I will go take my little iPad and go someplace else so that I can participate, because I think it's really important to be able to participate in this. So I'm going to, we're going to switch now to the retirement pension issue, and we're going to have Representative Copeland Hanses is kind of lay the groundwork for us here. But before we go there, I just want to say that so people understand, we know the bill hasn't yet passed out of the House, but we are trying to get a head start on it. So we are dealing with the bill as it came out of House Government Operations. That's what we're looking at now. We started a walkthrough yesterday with Becky Wasserman, got through most of the section on the governance, have not yet had a walkthrough on the task force. She will come back to us this afternoon and walk us through that. We are going to those are the two issues that we're going to deal with. We're not going to, and I don't mean to sound unsympathetic here, but we're not going to hear about how pension cuts will affect teachers or state employees, because we're not going, that isn't in this bill, is making cuts or changing the benefit structure at all. So what we're taking testimony on is the governance changes that have been suggested to us and the task force to look at the benefits. So that's what we're dealing with, only those two issues. So not to cut off people, but we're getting all of us are getting a lot of emails from different people about how they had planned their retirement and now they're not going to be able to do that because we're making changes. But at this point, we're not making changes, so we're not going to entertain those. We'll still hear from people and we'll still respond to them, but we're not going to take testimony on those, on any specific changes. Does that make sense, everybody? Does anybody have any questions about that? Or and as the bill then passes out of the House, we'll then look at any changes that might come through House and floor amendments. Okay. Hopefully that makes sense to everybody.
Yep.
Complete.
Okay, great. So with that, I'm going to turn it over to Representative Copeland Hanses for kind of a big picture overview. And then we'll hear from Representative Gannon about a little more detail, but remember, we haven't had a walk through the bill yet, so too much detail might befuddle us. So just as a reminder, and then we'll open it up to just kind of some general comments. And then our plan is on Tuesday to look, all day Tuesday we'll schedule to look at the governance section. That will be on Tuesday. And then on Wednesday, all day, we'll look at the task force, because it is going to be much more efficient if we look at them separately so that we don't get testimony that wanders between the two. Does that again make sense to people, that we will do it that way? So Tuesday and Wednesday, you can plan on Tuesday for governance, Wednesday for the benefits task force. Okay. All right, unless anybody has any questions for me or comments or wants to shut off my internet, I'm going to turn it over to Representative Copeland Hanses.
White, and thank you for giving us a few minutes today to talk about the work that we've been doing. I know that you can appreciate the intensity of this topic, and I think the way you're organizing yourself will hopefully allow you to focus your conversation. It sounds like a very good plan. I don't think I'm telling you senators anything that you don't know, but the reason why we're here having this conversation this year is because of the ballooning ADEC payment, the state's obligation to cover the unfunded liability within the pension system. And to understand the urgency of the moment, you only have to look at the rise in ADEC payment over the last 2 fiscal years. We are looking at an ADEC payment, funding an ADEC payment this year of $315 million, which I believe is around 13% of the general fund. And that 315 is 96 million higher than it was in the last fiscal year. And at that rate of growth, you can imagine how it will consume state spending. It is consuming state spending. And so, the ADEC payment is, as I said, the state's obligation. And so what we wanted to do as we were beginning our work on this is really understand what factors contribute to the size of that unfunded liability that leads to that level of payment. And it was important to me, at least, to understand the contribution of sort of sins of the past, short funding that was done in the past to the different systems, because I think that it's important for us to stand by our word. And if in underfunding in the past, we're creating a hole now, then we need to understand how much of the hole belongs to us as a legislature, even though it might have been before Senator Rahm was born that these mistakes were made. But at any rate, we spend a great deal of time, understanding the different things that contribute to where we are. And so that's what has led us to suggesting that this bill should include governance changes, because part of the challenge that we've observed over the last few years, over the last decade, is that our projections of what we thought we would get for investment income have fallen short of projections, and our assumptions on the demographic end. So, how many people are going to retire this year? What will their average final compensation be? How long will they live in retirement? Those assumptions have also been off, and to the detriment of the retirement system. And so that really begged a conversation around what can we do to beef up the governance structure of our pension system so that hopefully those predictions and projections are more accurate, more real in the future. But most importantly, that information gets communicated to the beneficiaries of the system. You probably all know that we had 2 public hearings, 4.5 hours hearing from workers and citizens in the state of Vermont, and it was stunning to me the extent to which there is misinformation out there about how the pension system is invested and how those pension funds are governed, because a lot of those folks coming in to talk to us were pointing their fingers directly at the legislature and saying, you mismanaged our money. And so, the story that we're trying to get out there now, and that we're going to ask the newly constituted VPIC to do in the future, is we are VPIC needs to communicate with the beneficiaries of the system so that they understand, how the fund is performing. We need greater transparency, and we need the beneficiaries to understand who the entity is and how they elect people to sit at that commission level to make those decisions. So you'll see the language around modernizing the VPIC is a proposal that came to us from the chair of VPIC and the treasurer, who worked together to propose these changes. And we have tried to the greatest extent possible to listen to the feedback that they've given us about how they believe moving towards a more independent pension investment commission will allow them to strengthen their performance in managing the funds. And so that's what you'll see, or you've already seen. You've already gone through that part of the bill.
We have gone through that part of the bill.
Okay, great. So I don't need to talk a great deal.
We made it up to 14, page 14.
Well, yeah, I mean, we went through the
Yeah.
most of the governance structure.
Yeah.
So you'll see independence, you'll see transparency, you'll see reporting, and more frequent testing of how we're doing on our assumptions. So then the other half of the challenge is, yes, we can, reinvigorate or strengthen the VPIC system, and that will theoretically improve our investment returns over time. But then we have to ask the question of, are the benefits that we are paying being covered by the contributions that are coming into the system, plus the investments that we're making? And that's a pretty important question to understand, and one that this task force is going to be focused on, because the reality is that people are living much longer than they did when these pension systems first came into being. And I think it's worth asking the legitimate question and taking the time to do that math exercise. Is this benefit matching the contributions that are going into the system, or are we going to perpetually set ourselves up for a challenge to figure out how to fund these over time? So in setting up the task force, we wanted to make sure that the task force had legislators on it, because as you all know, when and if a change in pension benefits is decided upon, it's going to have to come back to the legislature. So we needed legislators to be able to be a part of this, to be familiar with it, to understand it, and also, honestly, to be holding that space to say, we can't afford 13% of the general fund to be obliged to go into the pension fund every year. I mean, that's twice the size, almost twice the size of our entire Department of Corrections. And so we've got 3 House and 3 Senate members projected to be on this task force.
Just, if I can just point out, we haven't gone through this yet, so I would ask that you not go into too much detail on this until we have a chance to actually go through, but just do a pretty high level breakdown of it, because we haven't yet had a chance to hear Becky do the walkthrough and ask her just technical questions about the bill. If that makes sense,
Sure.
I don't want to get into detail that we haven't yet been able to. And just, I should have pointed out before that we've all done the retirement pension 101 with, is his name Chris Roop? Yeah, so we've done that. So we do have an understanding of the system. So sorry to interrupt you.
So I'll just go really quickly then, big picture, and then you can ask questions if you'd like. The task force made up of legislators, union representatives, and 2 administration members, and the director of retirement from the treasurer's office. And we felt that it was important also to designate that they need to take stakeholder input from a few other entities, in particular, employees from the Department of Corrections, because they are in a unique situation where they're doing a very difficult, physically demanding and stressful job that is not unlike our law enforcement folk. But they are in the standard retirement system that envisions them working well beyond when law enforcement works. So we would like the task force to sit down with folks from the Department of Corrections, and likewise, we need the task force to also sit down with folks from the judiciary, because there's a different retirement benefit for judges, and we believe it's worth taking a look at that. The task force has some direct targets that you will hear from Legislative Council on. We felt it was important for the task force to have some specific tasks that they were focused on in order to not spend any time, spinning its wheels trying to design what they're solving for. It was important to us that the Director of Retirement be at the table with the task force, because that is the person who understands how all of the benefits work right now, currently within both the teacher system and the state employee system. And that kind of expertise at the table is going to be critically important to help the task force unwind and figure out how to move forward. So we had a lot of back and forth about the timeline of when the task force should complete its work. And there were a lot of voices around our committee table who were saying, this is a huge problem. We need to figure it out right away. We also recognize that that this has been a very difficult and stressful pandemic year. And that for our educator workforce in particular, that stress doesn't alleviate until this school year is done. And so we are not starting the task force immediately in deference to the fact that the teacher workforce is going to have trouble engaging on this until mid-June. But we did feel that we needed to have a report deadline at the end of the summer months. And so September 1st is what we landed on for a due date. So that's roughly 12 weeks with the ability for the task force to meet up to 15 times. So if they have a couple of subcommittees that need to meet, they will have the ability to do that.
Any questions for Sarah? Very high level questions. I don't want, at this point, I think that we don't want to get into the detail because Becky is going to join us this afternoon and walk us through the rest of it. And I'd like just to make sure that our committee hears the walkthrough in a so that we can form our own perspectives and look at the details that we're concerned with. And with full respect to the House, the work that the House did, I think that it's important that we be able to look at it kind of anew, given the kind of high level that you've just given us. Does that make sense? So any questions, Senator Rahm?
Well, I just feel like we should, ask a question while we have our chair here who's been through a lot on this bill. Representative Copeland-Hanses, you and I were both here about a decade ago, the last time that we had to have a major negotiation like this. What do you hope will be different this time from the work that we're starting to roll out than it was last time? Because we know that we, in some ways failed to solve the problem then. So what do you hope this process does differently?
So I appreciate the question. And I think the answer to that falls into two categories. One is that I believe that the improvements that are being made to the Investment Commission, including independence, transparency, and reporting, are going to help on that side. But with particular respect to this task force, Representative Gannon and I spent a lot of time reviewing what the makeup of the 10 years ago task force looked like. And we wanted this process to be more collaborative, with the folks from the unions being able to come to the table with legislators and with administration folks, so that we can all be at the table making the decision together. This is a challenge that impacts, Governor Scott's administration, as well as the legislature, as well as our unions. And so we wanted to make sure that there were voices from all of those perspectives.
Any other questions for Representative Copeland-Hanses? Yes, Senator Clarkson. You're muted.
Thank you so much for the work that you guys have undertaken. We appreciate you teeing it up for us so well. And I'm just curious, given that we're probably not going to have time to do a public hearing, how many people did you actually hear from in those 2 hearings?
So the first hearing was 2 hours long. I think we heard from 32 or 35 people. The second hearing, we extended a bit longer to 2.5 hours. So I think we had 45 or maybe 50 people, 49 maybe. In addition to that, when folks registered for the public hearing, they also were able to find the email address to submit testimony. And so we, on our committee page, you'll see volumes and volumes of written testimony that was submitted by both by people who came to the public hearing, but also from people who weren't able to attend.
Great. Thank you.
And I think the difference now is that from what I understand, most of the people who were coming to the public hearing were concerned with the proposed benefit restructuring, not talking about governance or the task force. They were concerned with the proposals to change the benefit structure.
Right. That absolutely. And my guess is that's big. And we're now, of course, getting all the input from all our constituents on these issues.
Right.
They're now more focused on those 2 issues.
So anybody else have any questions for? And I thank you a whole lot. And I know that it's been tough. This is, and it's an issue that we need to be serious about, and we need to have empathy, and we need to really make sure we're doing the right thing. And it's particularly hard to do that in our virtual settings. I guess that's what they're called. Or anyway, the way we have to do this is very unsatisfactory in terms of having real conversations. So I acknowledge the work that you've done, and under really difficult circumstances. And that's true of all the legislation we're doing this year, but this has such an impact on so many people, and those people who we support, our teachers and our state employees.
Exactly.
So, yeah.
And our troopers. Oh.
I will just make a comment about our state employees, and this is not saying anything about a negative comment about teachers, but we confirmed today some governor's appointees, and 2 of them, Beth Vestigi, Commissioner of Human Resources, and Suzanne Young, Secretary of Administration, both in their hearings with us around their confirmations, spent a lot of time talking about how they were so impressed by and supportive of the effort that our state employees put in around the pandemic and dealing with that, and putting themselves out there in front and really being responsible. So I just wanted to pass that on, because that was really good to hear from them. Okay, so are you guys on the floor right now?
No, we are done for the day. So I'm gonna hang out here with you fine people, and
You're done for the day?
we
Yes,
are.
they were done time for the women's caucus to meet, actually.
But they went until like 9 o'clock yesterday.
We had an 8.5 hour Zoom floor yesterday with multiple roll calls.
With
Oh my
you were
God.
bottled up, I understand.
Yes, exactly.
Okay, well, so I am going to Becky will, I apologize. Becky will be joining us. I'm not sure at what time. Gail, did she say what time?
Yeah, she'll be here at 3 p.m.
At 3. Okay, so I guess before we go there, then I would just like to have kind of some general comments from people, knowing that we're going to go into great detail on the governance on Tuesday and the task force on Wednesday, but to just have some general comments, and if we have questions, ongoing questions for Chair Copeland-Hanses and Representative Gannon, we'll just try and do a kind of a conversation. So with that, I think I'll go first to Mr. Galanka, and I do apologize here because you're not someone who's usually in our committee, and the rest of these people we see all the time. So I didn't bother introducing ourselves, but we will do that now because we don't normally see you. I'm Jeanette White from Windham County.
Thank you, Madam Chair.
Hi, I'm Anthony Polino, Washington County.
Hi,
Brian
Senator.
Collmore, Rutland County.
Allison Clarkson, Windsor County District.
Keisha Ram, Chittenden County.
Nice to meet you all. Thank you
Thank
for
you.
having me.
Yep, lovely to have you.
Thanks for being here.
So I
So-
can, what would you like me to, I can tell you a
Well,
little bit
just-
about myself and how I got to VPIC, and I'm the
And
current
what kind of what
VPIC chair.
and just your general, support or non-support for the,
Oh,
where we
sure.
are, and you
Sure.
just general comments. And then I know that you have a particular interest in the governance part of it, so.
Yes, no one else
we'll-
does, but I have a strong interest in governance. But I will start by saying, I think the House GovOps Committee has done a tremendous job working with all interested parties, including the treasurer and myself, in trying to craft a law or a bill that incorporates a lot of the ideas that we've been trying to foster or develop just in-house, over the past 4 or 5 years. I came to VPIC as a municipal alternate appointee. That was a while ago, but it was through my affiliation as a city council member in Montpelier. And so I come from the municipal side, really. And so I was active in the benefits and working on the underlying pension board for the municipal system. From that, I was appointed to VPIC as an alternate. I became their voting member in 2015, and then the members voted me as chair in 2016. So I've been chair of VPIC since 2016. Since that time, we've really gone through a major reorganization of the VPIC structure, as well as our focus in regards to investments. And we've really taken the approach of simplification, lowering fees, bringing in expertise, and actually owning the investment process that we have here in the state of Vermont. So I think it's translated, although the performance numbers of the past have been relatively poor, I think you'll be pleased to see that we've increased those numbers significantly since 2016. In fact, back in 2016, when we took over, I think we were in the 95th percentile of our peer groups in terms of performance. As of December 31st, we were in the top 18% of our peer groups. And that's based on a 5-year number. So it's not really just a short-term number. It's really more. And it's really a credit to Beth. It's a credit to the treasurer's staff. And it's a credit to VPIC and the ability for us to actually make the changes that we've done over the past number of years. I think what this legislation allows us to do is really get to the next step. It really takes us, I think, to the next level and ensures the protection of VPIC from future political influences that may affect the treasurer's office. Beth's great with us right now, but I think the structure in place right now could stand tightening up. And I think that's what this legislation does. I took to this process really 4 things that I wanted to see come out of it. And we talked about this at the VPIC level. We wanted to move towards independence. We wanted to increase transparency. We wanted to increase accountability because we want people to know what we're doing. And we also wanted to maintain continuity of the progress and changes that we've made over the past couple of years. And I think this bill accomplishes all of that. And I do want to thank Representative Copeland-Hanses and Representative Gannon for really integrating us into the process and taking our advice, even though it was some of the things that were against their original bill. I think it really, make the bill so much better by integrating some of the existing practices that we do. So I'm happy to answer any questions on, VPIC or the performance or this bill, but I strongly support it. And Beth and I have been integral in its creation, so we're happy with the results.
Thank you, committee. I'm going to make a suggestion here for the committee members that in order to expedite the kind of questions and answers that we might have from people as they come to us to talk about either the governance or the task force, that when Becky walks us through the rest of it, we will definitely have some questions. I've highlighted a bunch of places where I have questions. I either need more understanding about this, or why did we do it this way? That if you would send those questions to me, I will make sure they get on our committee page for Tuesday, so that when Mr. Galanka and Steve Howard and Jeff Fannin and Mike O'Neill talk to us, they have, and the treasurer and all the other people who are going to talk to us, they have those questions in mind, that those are things that we've already highlighted as concerns. Does that make sense, committee? I mean, we'll still have time for questions and answers, but if we can give them some heads up for what some of the questions and concerns might be ahead of time, I think it would expedite it, and it would help them to know where to focus. Does that make sense?
Yes, I think that makes some sense, as long as we reserve space for inspired new.
Oh, I'm not saying that that would be the end of it. I'm just saying that if we all have well, that's all. I'm not saying we're not going to have questions and answers, but it will give them a heads up to what questions we've already unearthed. Okay, Senator Rahm?
I think I understand that. This kind of going from the previous governance structure to the new one is something we went over with Becky. So I didn't know if I could ask Tom a question related to that, just as somebody who was in the past, is in the current governance model.
You want to ask him right now?
I'll be happy to.
Sure.
Yeah.
Okay. It just struck me, I was kind of fixated on it, so it could be immaterial, but it looked like certain people were compensated for their role, and it sounds like a very big responsibility. And other people, if they were public employees, were not compensated. And I just wondered, it felt like a big difference between who is a public employee, who's salaried, who makes a lot of money, and who might participate, who doesn't make as much money. Would you say that in your role, it feels like you receive compensation that's adequate for the work that you do on that?
Over the past 2 weeks, I don't know if I'd say that, but I left that to VPIC to decide. It's in statute that they could pay me, and they've elected to pay me. I'm the only paid board member or member of the VPIC board. VPIC does have 3 paid staff, so I don't know if that you're aware of that. We have a chief in number of years ago. We used to have a director of investments, and we expanded that role to get a chief investment officer. So we brought in a former chief executive officer, chief investment officer who ran a large endowment fund. He ran the Hershey Trust. And so we brought him into the state of Vermont. We were lucky to be able to bring him in. And he's helped us tremendously in regards to bringing a more in-state focus from our investment staff. We also have 2 other employees that work in the treasurer's office that are strictly dealing with investments. And they're terrific. But we run this on a 3-person shop, basically. I know Treasurer Pierce has always said she's asked for 1 employee per billion. Well, we're up to 5, so 5.5 billion, but we only have it on 3. So maybe that's why she wants us to go independent. She doesn't want to deal with us anymore. But I think the internal staff is the key to this independence, is to figuring out how we run this. They're the only compensated members of the treasurer staff.
I guess my question was kind of, do you feel like there's reasonable offer of compensation for people to participate as commission members, given?
Well, that's an interesting question. Should commission members be paid? I personally think they should, at least at a more level than a de minimis, daily rate. At what level, I'm not really sure. We plan on having a compensation study over this upcoming next couple of months, where we've already commissioned that, and that's part of the bill that will have that done by January. It's an interesting question, because you do have difficulty getting people volunteering, particularly as you expand the board. Getting people to commit to. It used to be, when I first started with VPIC, the meetings were a day or 2 full days. We've limited that, so they're much more efficient. And the agenda, we usually have half a day meeting every month, and then we meet as needed. But I do believe that that's an interesting question that should be explored in this committee review. But we don't, I don't know. I'd personally say yes, we should pay them more, but I'll wait till we hear the report and then make a final decision.
Thanks. And while we have you, I have one more question. I think there's been some spirited debate about how well our returns are doing, how well our funds are doing in terms of the returns we're getting. And I think the last thing I saw was Treasurer Pierce saying we're doing well for a small state of, some size. Like it seemed like, yes, that's probably true. But, how would you characterize the ways in which you all have tried to measure performance, boost performance, look at what other states are doing, look at like pooling or anything regional? Like how would you characterize the success of the returns?
Well, we compare ourselves against funds that are $1 billion to 10 billion. So we're right in that middle of that range. And I think we compare, I'll check the latest number. I have it on my other screen. It doesn't say how many are in that benchmark, but it's a significant number. We utilize RVK as our investment consultant, and they're a national, one of the top 5 national firms for investment consulting work. So we complement our staff with our work with our investment managers or our investment consultant. And this is the benchmark that they've set for us. We haven't tried to change that. We've tried to keep it as neutral as possible so it can be comparable over time. But if you want to know the real performance, I can send you the most recent report. I think it's up on the House page. Through February, our 5-year number was up 10.36%. Our 10-year number was up 7.07%. So yes, it's somewhat time endpoint sensitive. So it's hard to really, you look at last June in the middle of the COVID crisis where markets were down, it looked worse. And that's where we lock in the data value for the actuarial report. So it really is endpoint sensitive when you look at that number. So you can cherry pick different dates and say either are better or worse. I like to look at key dates, whether it's fiscal year end or whether it's December 31st, and then you can have a good comparison against your peer group. But I'd say we're doing a lot better than we were. When I first stepped into this, we were relatively poor versus our peers. And I don't want to blame that on old VPIC. I just don't think they had the resources in place. I don't think they had the structure in place. They were taking advice of a lot more Wall Street firms, and we had a lot of complicated investments that charged us a lot of money. And those were all drags on investment return before 2016. We've ended up lowering our investment fees by about 37% if you go on a basis point basis. And so we originally, back in 2016, we're paying about 63 basis points. And a basis point is a fraction of 1%. So right now we're down to about 41 basis points. So we've really made a concerted effort to index where possible. But when we do not index, when we go to active managers, we need to own them and justify why we own them. And I'll say one of our probably more expensive investments is actually a local firm up in Burlington that has done the best versus their peer group, and we probably pay a little bit more for them than our index products. But that keeps money here in Vermont, and we've utilized the money in that way. But I'm proud of what we've been able to accomplish over the past 6 years, and I don't want to. I know we need to look at the old performance data, but I think this will help us continue the positive trends we've made over the past couple of years.
Thanks. And just so that I'm hoping that you will be with us again on Monday when we go into depth on the proposed governance structure.
Tuesday. Was that Monday or Tuesday? I'll be happy.
Sorry, Tuesday. That's the beginning of our week. So yeah, Tuesday.
Yeah, I'll be available Tuesday.
Sorry about that. So unless there are more questions right now for Mr. Galanka.
Actually,
oh, yes.
I don't want to take us off on a tangent, but if you could just speak briefly to the benefits of independence. And I wonder whether around the country.
I'd rather wait until we can talk about that on Monday when we can go into detail on the proposal, because we're going to spend all of Tuesday talking about the proposed governance structure. So we'll be going into detail with Mr. Galanka and the treasurer and all the others concerned about the benefit of or non-benefit of independence. Right. Is that okay?
Sure.
Okay, thanks. So I would like now, I think, to jump to Steve Howard. If you would like to have some comments, and again, remember, we're not talking about benefit structure. So take it away.
Thank you, Madam Chair, and I'll just try to keep it very general, and I trust you'll correct me if I start to get in a little into the weeds too far.
I certainly will.
Thank you. Thank you for the opportunity to testify. For the record, I'm Steve Howard. I'm the Executive Director of the Vermont State Employees Association. For the state employees, this discussion is really one about fairness, balance, and equity. And both for the governance changes and for the pension task force, that is an overriding principle. I think if we've learned anything in this process is that the process really matters. And unions are used to a process where the workers are seated at a table with the management and they have equal power. They are full participants in the process. And we've been able in that time, during that the collective bargaining process, to come to agreement with the administration, with administrations of both political parties over contentious issues, big contentious issues. So the process really does matter. And so as we look particularly at the pension task force, the overriding issue is whether we're going to have an equal seat at the table. What we ask for in the House and what we'll ask for in the Senate and potentially on the floor of the House next week is that there be the same number of labor seats as non-labor seats. And that is very important because our members want to help solve this problem. They want to participate in a positive way, but they don't want to be subjected to a process where they think the cake is already baked, where they think it's just a process that is being set up because it had to be set up in order to get to a final outcome that was already predetermined. That's not what we're used to in collective bargaining. It's certainly not even in the legislature what you're used to when you have a conference committee. You can imagine if there was a conference committee on a bill and the House got 4 members and you got 2. It just is a very important part of this discussion. And our members are ready to have this discussion, but they don't want to be part of a political process that looks to them at this point like just a political operation that's been set up to get somewhere where the leadership wants to go. We think there has to be a give and take and equal power and balance in order for the process to have credibility. So that next fall or next January, potentially we have an agreement that we can all work together to implement rather than being at crosshairs or in conflict because we felt like something was done to us unfairly. So I would just leave that with you. We also think it's very important that it be tripartisan, that we not make this something that is controlled by one party or another, but that it be tripartisan, that we include all 3 major parties that Vermonters have sent to the legislature. It's really important to our members that be part of the process. The other, I think, important part that is consistent with the membership of the task force is that the task force not have prescriptive language in it that says what the outcome should be or what the goal should be. That the goal be left up to the task force to decide. Right now, the bill that's in the House that will be coming over to you says very specifically exactly what they have to do. And that seems like not a good idea from our members' perspective. That's not really allowing them the freedom to use their knowledge and their skills and their ability to negotiate to come up with the best solution rather than the solution that somebody wants now and is just willing to wait until next year to get it. So that's really important, particularly around the benefits. That's another point that I think I would point out. This is the Government Operations Committee. I don't have to tell you that we have a hard time now recruiting and retaining state employees in very difficult positions in state government. Our pension system is 7%. The benefit from the state employees pension system is 7% less than the national average now. And so it's really important to have that in mind, that if we reduce those benefits significantly, the 30 vacant state trooper positions, the nearly 100 vacant correctional officers, the millions of dollars we spend on traveling nurses and IT professionals, that is really going to get worse because the retirement is so, I think one of the things we heard in the public hearings, and I hope the House members have learned, and maybe we can impart that knowledge with this to the Senate, is that retirement is aspirational for state employees. Every day they work in jobs almost nobody wants to do, difficult jobs in which their life is in danger. And they aspire to the day when they can retire with dignity. And when you have a process that locks them out or controls what is done, and you cut that benefit too substantially, you not only squash their dreams and their hopes, but you create a situation that has broader implications for state government's ability to deliver public services, and in this case, public safety and other really valuable and important provisions. The other thing I would just say is it's very important to our members that this not all fall on them. This was not the changes in the assumptions and the situation that we're in isn't one where you can just cast blame, to legislators or to state employees. It's not that simple. We've been very clear with our members that, at least on the state employee side, that the legislature has always funded their pension, and that in fact in the last few years they put more in than what was required. It's not the state employees' sole responsibility to solve this on their backs. And so we asked the House, and we would hope that this process of the task force would spend significant amount of time on a dedicated revenue source, because one-time money is helpful. It's just not that helpful. Having money, as a treasurer said to us early on in the fall when we started talking with her, spending 2 or 3 hours twice a week at least trying to find a solution. You could put one-time money in, like the $150 million that's being held in reserve. It doesn't really make as big a difference in the unfunded liability as if you were to dedicate a revenue source. The state of Colorado has dedicated the revenue from their the leases on their ski areas to the unfunded liability in their pension system. That has got to be a centerpiece of the outcome. It can't just be on what benefits we're going to cut for state employees and how much more can we take out of their checks. It's got to be also an acknowledgement that we have to have a dedicated revenue as part of that solution. I think the last thing I would just say is transparency is really, really important. And one of the things that we ask for, and I think it's probably going to be just sort of common sense, our members, one of the silver linings of doing this in COVID, which you couldn't have a worst year to have a proposal like this than one in which our members are at the tail end of having led the state of Vermont through a pandemic. Our members are exhausted. I suspect the teachers would say the same thing. This has been an incredible roller coaster for them. But one of the silver linings is that they watch the legislature on YouTube. And they are able to see what's going on in their state house in a way that they haven't really ever before. So it's very important, I think, that every single one of these 15 meetings, if that's the number we settle on, that they be on YouTube, that they be publicly available in a way that's accessible to people who work 12 or 16-hour shifts. And who might be watching it in the middle of the night, you know. That's just another point that I would make. So right now we cannot support the bill as it passed out of the House Government Operations Committee. We don't think it's fair and balanced, or balanced and fair, however you want to say it. And we think with just some slight improvements of just balancing out the membership, taking some of the prescriptive language out, we could have a process that we believe in and that could actually have the credibility that would lend itself to a real solution that the legislature could consider next year.
Thank you. Any questions for Steve? And I just want to make sure that you understand we're not getting into detail today about either of these two, because we'll be getting into that detail on Tuesday and Wednesday. But Senator Collmore?
Thank you, Madam Chair. And I think I can stay high enough in terms of my view. I chose the wrong word. So again, Steve, without getting into specifics, and I know how many members there are going to be or potentially could be on the task force, how would you characterize the imbalance right now? And I don't mean.
I'm going to ask us to wait with that
Okay.
question until we've actually had a chance to walk through the section that deals with the task force, and then for Steve to answer us, because we haven't even walked through that yet. Many of us have read it, but I think that's a detailed question that we need to leave for Wednesday. I'm sorry, Senator Collmore, but I think that is asking him questions that go beyond. I mean, I have some thoughts about that, but.
Yeah, all right, that's fine.
Okay, Senator Rahm?
I think this is high level enough. I feel like the chair is going to like disappear from
Well, no, I just want to make sure that we still have to hear from Jeff Fannin and Mike O'Neill
Yes.
about their initial reactions and where they are. And then Becky will be with us and walk us through. And I just want to make sure that we don't get into such detail today without having at least walked through so we know what we're talking about.
Right.
So then,
Okay. So Senator Rahm, did you have a question?
So, and maybe this is one that others can answer too from their respective, positions and those they represent. I think it strikes people when we hear 13% of our budget is going to, fund our retirement system. But at the same time, a lot of our money goes to personnel. So would you say that's pretty normal around the country? Is there a reason you think we might be an outlier in how much we're spending on retirement, or is that just a natural byproduct of us spending the necessary resources on personnel?
I think that's a very good question, Senator Rahm, and I'm trying desperately not to disappoint the chair, so I'm going to be very careful about how I answer this. The sky is not falling. We are not in a crisis. The pension system isn't going to fail tomorrow. And that is, I think, an important thing to remember. There's $5 billion in assets. And in 2010, we entered into a plan to pay off the bulk of the unfunded liability. The legislature knew at that time, the treasurer and certainly the unions knew that the ADEC would automatically increase, that there would be increased payments to the ADEC. It should not be a surprise to anybody that the ADEC is increasing. The $96 million that is higher in this particular discussion is because of the change in assumptions. It's directly related to the change in assumptions. So yes, we should look at the assumptions. We should find out why our investments haven't historically hit what we thought they would, and potentially we have a more realistic number now. But I would say that the amount that we are paying should not be a surprise to anybody in the General Assembly or the administration, the treasurer's office. It was agreed to in 2010 when the state employees also increased their contribution to the fund.
Okay, thanks. I'm going to ask Jeff to weigh in. Oh, yes, Senator Clarkson.
Well, just as we begin to prepare ourselves for this conversation, it would be great, and we should ask Becky this, but perhaps others have it. And actually House GovOps may already have this, which is comparing exactly, to riff off of Keisha's question, where are we, where do our pensions stand in regards to other states? I mean, what percent of their general funds are their, just some comparisons that are just would be very helpful as we go into this.
I think that we have that, and I think that actually Chris gave us a lot of that information in his presentations, and he compared us to both Social Security states and non-Social Security states, because there's a huge difference. So I think that we can go back and look at his slides. I believe he gave that to us.
Yeah, not all of it, but a lot of it. Yeah.
So Jeff?
Thank you very much, Madam Chair, and welcome to Friday afternoon committee members. So for the record, Jeff Fannin, Executive Director of Vermont NEA. I thought Steve did a nice job summarizing, so thank you, Steve. I'll try to stay at the high level and not go into the weeds and get weed whacked in the process.
Sorry about that.
No, it's fine. It's appropriate because you haven't had a chance to go through it, and we've been on the House side going through it a lot, and so we will quickly get into the weeds, and that's not where you need to be right now. And that's understandable. This is a complex topic, no doubt. It's as Steve alluded to, we separately, because we're the teachers plan from the state employees, but we, like Steve and Mike O'Neill, met with the treasurer starting in right before Thanksgiving, twice a week, most weeks, trying to go through this and trying to understand it. So we had the luxury, I guess, coming into this, having had a lot more foundation laid for us. So I can understand your need to get up to speed and not get too far into the weeds before you get that. So if I go there, please pull me back and I'll stop.
I will.
I know that you will, Madam Chair. A couple high level thoughts. So when we talk about composition, and Steve talked about it, and we didn't rehearse this. I have not spoken with Steve today, I promise you. When we talk about balance and fairness, what I think of, and it maybe goes to your question, Senator Collmore, and is balance would be planned participant and non-planned participant. So some people, call it different things, but that's how I see it. If you're a planned participant, you're in the plan. And if you're not in the plan, you're a non-planned participant. So we see this as planned, the balance, necessary balance on the task force between planned participant and non-planned participant. So that's how I see it. And that's what, when I say balance, that's what I'm talking about. So maybe somebody else is mentioning it in a different way, but that's how we see it. And so also as well, we think there needs to be balance in their charge. So simply, alluding to what Steve suggested, my members, the teacher members, who are watching and concerned and doing their hard work, maybe they're probably still in school now, may watch it later, but they don't want to. The process that they saw leading up to H449, they didn't think was necessarily fair, and so that was what they came out and spoke about in the two public hearings. The first one, just was truncated by a lot of, there was an electoral storm and a lot of people lost power. So that number kind of got dropped down a little bit. I think there were 18 no-shows that day. Probably didn't have power. But so we think the charge of the committee, of the task force, needs to be balanced as well. So that's what, when we come to you next Wednesday, when you have that discussion, it's not only just composition of who is on the committee, but also the charge of the committee to make sure that there's fairness in process of the charge that the task force will look at. So in concept, we with some tweaks, as Steve mentioned, We think the idea is the right approach. Let's look under the hood. Let's see what happened. How did we get here? And as Steve alluded to, the two changes last year that dramatically changed the numbers that you're facing, that we're all facing this year now. One was a re-look at the demographic assumptions of the plans, and the other was the rate of return. Now, those were sort of what I would call human changes, right? People made decisions that then have the state, if you will, or all of us needing to contribute more, and that's what's being asked. But that's because actuaries changed their assumptions last year, and the investment people changed their assumptions, the rate of return assumption, they lowered it, and they recommend a lowering to the three boards. So as Tom Galanka mentioned, he's a member of the VEMR's board, the Municipal Employees Board. And just for a quick side trip here, 2/3 of the people in VEMR's, the plan participants, are school employees. So if you're not a teacher, you're a bus driver, you're a cafeteria worker, a paraeducator, and your school district, it's not required, but if they do, and most do, participates in the VEMR system, the municipal system, 2/3 of the people in the VEMR system are school-based employees. Obviously, the teachers are all teachers. They're licensed teachers, but that includes administrators as well. So principals and superintendents are also in the teacher system. And then, of course, the state employees, and I'll let Steve and Mike not worry about that, but explain to you those folks. So those are the three systems at issue here. And really, the VEMR system is not at issue. The VEMR system, as Tom will probably better explain, is on better financial footing. And it's a teacher system and the state employee system that we're discussing. So just sort of setting the table a bit about what you'll be discussing next week. And also I'll go into that. So I met this morning for a couple hours with some administrators. I do this annually. I'm invited in, and we have a good conversation about labor management issues, school pedagogy issues, and other matters that administrators worry about, and we frankly do as well, and we thought we'd have a conversation. So I do that annually. And they are tired. The teachers are tired. This has been an incredibly challenging year, and we're over a year now of being in a Zoom environment, for teaching. So I know it's tough for you and for all of us, and I would much rather be in the State House. But to teach kids, part-time, not part-time, but some kids are there on Monday, Wednesday, some are there Tuesday, Thursday. It's a hybrid system. A lot of the elementary schools are in full-time, but some segment of those kids are being taught via Zoom or otherwise, other platforms, because for whatever reason they can't be in school or don't want to be in school. So there's a variety of different settings that teachers are operating in right now. And they're tired, they're tough. They're tough, but they are really tired. And to get these proposed changes a few months ago and a few weeks ago was like a kick in the stomach. And so that's what they reacted to. That's why there's a lot of email communication with all of you here and your counterparts in the Senate and the House. But that leads me to this overarching concern I have is recruitment and retention of teachers. It is, I hear it, we hear it a lot, and we're hearing a lot. Superintendent in Slate Valley, which is over on the western side of the state next to New York, Slate Valley, Fairhaven, 40, I think it was 39 vacancies. Teachers have options on the border, particularly. They go to New York and make more money in salary and in benefits, including pension. Massachusetts, the same. Now, they're not a Social Security state, so they don't contribute to Social Security. So it's a little different there, I admit that. But New Hampshire as well. So there's a lot of people who are looking around and deciding whether they want to continue to teach. And I think one of the demographic challenges the actuaries readjusted for was that people weren't staying in the teacher system, as long as they used to. And so by potentially lowering their benefit and asking them to work a little bit longer and pay a little bit more, I'm not sure we're going to address
we're not
the
doing
problem.
that. We're not talking about benefits.
I understand, but looking at it is going to possibly exacerbate a problem that
it probably will, but I don't think we should assume that we're going to go anywhere.
I know. So, but all I'm saying is the recruitment and retention issue, I think, needs to be part of the task force's mission, because it's part of what is the reality on the ground about the pension system. So I think, I think the task force should look at that. And Steve alluded to it, the state system has not been underfunded, but the teacher system was up until 2007. 25 of the 29 years, dating back to 1979, the teacher system was underfunded. In some cases, 33% of what the actuaries recommended. I think it was 38% maybe. But so that's, sort of reverse compounding. We think that needs to be baked into the task force mission to look at that and incorporate that into its thinking. So, those are sort of the high level. And finally, I'll close with, we did, as Steve alluded to, we very much were participating in the discussion back in 2010 and 2014. So teachers then were asked to pay more, work a little bit longer, but we were able to achieve a balance in what was asked of them and what was asked of the state. So everybody gave a little bit and got a little bit, if you will, in 2010. And then in 2014, we made some moderate changes again. So we think that's the right approach. We appreciate, I definitely appreciate Representative Copeland-Hazes and Gannon's efforts in the House. The bill's improved from what it was. I still have some tweaks along the way, and we think we can do that here in the Senate, maybe if it doesn't happen in the House. And so I thank them, the House members here and in the committee. They did good work. It's not easy on Zoom, and we hope to continue that good work here in the Senate with you and make some refinements as necessary, assuming it comes out of the House next week, as I think we all do. So we will be back. I appreciate knowing now in advance the governance on Tuesday, task force on Wednesday, and we'll prepare accordingly. Thank you.
Good, thank you. Yes, Senator Rahm.
Thanks, Jeff. As you were talking about what the task force should be looking at, it made me think of externalized costs of reducing the amount of savings people have when they're older. And I think we see that particularly for older women. They are more likely to slip into poverty and have their fixed income not meet their basic needs. So I just wonder if you forwarded any thoughts like that to the House committee on the experience of having 75% of teachers being women, and that impact that could be had on the externalized cost to our state of having them have less income.
I did, and I think we could do better in some of the language that's there. I'll just say that. And I was in Senate GovOps back in the early aughts when they had to increase teacher pensions for some folks at the bottom who were living well below the poverty line. So we had teachers, and so we had to unilaterally, your predecessors in the Senate GovOps committee had to unilaterally increase teacher pensions because they were just so they were just not what they should be, frankly. They were well below the poverty line. And you're right, 77%, I believe, are women in the teacher system. So the gender issue is real, and we need to make sure that we don't exacerbate that problem. I'll say it that way.
Thanks. I'm going to jump to Mike O'Neill from VTA, unless there's something else burning for Jeff.
Thank you.
Thanks. Mike?
Good afternoon, committee. Mike O'Neill, for the record, Director of the Vermont Troopers Association. Thanks for the opportunity to speak about this. And, I anticipated getting into more detail today. So to be honest, on a Friday afternoon, I'm glad that we don't need to. And Steve and Jeff touched on just about everything that I would say as far as concerns we have from the VTA. Jeff said he and Steve didn't talk today and plan their testimony, but Steve and I did spend a lot of time talking today. And we spend a considerable amount of time, trying to address the concerns our members have. Like Sarah mentioned earlier, the misinformation that is out there with a lot of our members. We're spending a lot of time trying to correct that and making sure there is an understanding of how we got here, the things that have led us here, what has taken place in the committee and the decisions that have been made and why. And we appreciate the point that this is at, where we are talking about a task force to look at what the recommendation should be as far as what savings should be looked at, what the benefit changes, if any, should be, or how those should be structured. Yeah, we feel the most important thing, like Jeff and Steve have both said, is balance on this task force. Yeah, is labor fairly represented on this, so that it is a conversation everybody walks away from feeling like they were heard. Yeah, whatever conclusion the task force comes to and whatever recommendation is made, we're going to have another reaction next year from our members. And our hope and goal is that it's one that they're in favor and support of, whatever the task force recommends. Yeah, Jeff just said one of the most important things that should be looked at from the task force is recruitment and retention. You know, retirement benefits are expensive, but what is the cost of doing damage to the workforce that may take years and years to recover from? Yeah, there is already a big feeling from our members, from the troopers, that it's time for them to start looking at other employment. Yeah, and for state police, a lot of our members will look at other states. For state employees, they may look at the bordering states, the same for teachers, and it's not that hard to go across the border. For law enforcement, we're already facing a crisis in trying to recruit and retain the people we have. It is not a profession right now that is easy to attract people to. And I don't think we need to get into the reasons why. I think those are very obvious. But I don't think there could be a more important time for us to be ensuring that we are maintaining our ability to recruit and retain, or even enhance that ability. Because we can't face a problem where we're losing people and we can't replace them with good people. It's just something we can't survive right now. And I know Steve and Jeff are thinking the exact same thing. That's not unique just to law enforcement. We just happen to have a big problem with that right now. So whatever the task force recommends, I think that has to be a huge part of what they're looking at, is if we make changes, what does that do to our workforce? And is there a cost to that? Because we can't afford not to look at that. I think that's all I need to say for today. I'm looking forward to getting into more detail on this next week.
Thank you. Any questions for Mike right now? I will say that the whole issue of, and this isn't just related to this, but I just given the what we were doing right before we got here, recruitment and retention is an issue in almost every profession in Vermont. And we just heard for those of us who live in border communities, it's particularly an issue. And we just heard from our EMS people this morning, for example, that they just lost 4 paramedics to Massachusetts because we can't pay them. So and that's happening on the western side of the state and on the eastern side of the state. And so it's a huge issue. We can't solve all of those problems, but we will address them where we can. And this is one of the areas where we have some say in that, but it is a huge issue for all professions, nurses, lots of people. So. Okay.
I have
committee. Oh, it's Senator Rahm.
I feel, I just don't know where the conversation will go next week. So,
it's going to go into a lot of detail. Believe me, we're going to have 4 hours each day.
As we look at maybe ways that this task force can be kind of, I don't know if I want to say visionary, but like really look at, quality of life and how it relates to retirement age, et cetera. I was just struck by, obviously troopers were particularly concerned about the age change. I'm not getting into what was in the past bill. Sorry, Madam Chair. Yeah. But it made me wonder, some people reached out with very similarly physical jobs, dangerous jobs, demanding jobs that made me wonder about looking at retirement age for other similarly demanding jobs to law enforcement. And I wondered if you had any thoughts on that or have ever sort of advocated.
If I can throw out that I think Representative Copeland Hansa said that the task force is specifically to address DOC. because they do have, are in that category. And so we will hear from that, but I don't know if Mike wanted to answer that.
I can try to. What I can tell you about our membership and the people that we recruit, retirement is one of the biggest benefits they look at when making decisions on whether or not to come into the workforce or whether or not to stay. It's something everybody nowadays really focuses on. At the end of your working career, what is going to be there for you? And without getting deep into it, a lot of our members understand, as we believe, there's a contract with retirement. When you start paying your contributions into the system, we believe there's a contract that you are guaranteed those benefits. And when they heard those benefits could be taken away, there was an extreme reaction in the public comments that the committee took. So it's something that we have to look at, not only for law enforcement and what the retirement age is, for everybody. What is the right benefit structure to retain and recruit our people? Money shouldn't be the only factor in determining what retirement benefits are and what the cost is. There is a cost for maintaining these benefits, but there's a cost for not maintaining them.
Okay, thank you. And please feel free to stay with us, as I see we've been joined by Becky, to stay with us as she walks us through. And when we walk through a bill, we try to limit our questions of the drafter to questions of technical concerns or what this actually means, because the drafter of the legislation is not responsible for the why did they do this or why didn't they do this. So but you might get some, as we walk through it, there might be technical questions that we have that might help you understand where some of us might be going next week. So Senator Clarkson?
Madam Chair, we have been sitting.
I was going to suggest a 5-minute break. I just looked at the clock and then I saw that Becky joined us, but yes, we need a 5-minute break. We've been here since 1 o'clock. So 5 minutes, we'll be back.